Today's video topic is labor induction. Labor induction is a medical procedure to start the labor process artificially. It is typically done to help a pregnant woman move into labor and deliver in a timely manner. It usually involves the use of hormones such as oxytocin or prostaglandins to encourage the uterus to begin contractions. It can also involve medical interventions such as breaking the amniotic sac or manually stretching the cervix. The goal of labor induction is to ensure that the baby is born at a safe time and in a healthy condition. Reasons for inducing labor. There are a few reasons why a doctor may recommend labor induction. One of the most common reasons is that a pregnant woman has gone past her due date and is considered to be at an increased risk for complications. In some cases, labor induction is done to protect the health of the mother or baby, such as in the case of the baby not growing as expected, or there is too little amniotic fluid around the baby. Other reasons for inducing labor include a non-reassuring fetal heart rate, an infection, or if the mother's water has broken. When to induce labor. The decision to induce labor is one that should be made by the doctor in consultation with you. Generally, induction is not recommended before 39 weeks unless there are specific medical reasons for it. The risks of labor induction should also be weighed against the risks of continuing the pregnancy. It is important to remember that labor induction is not always successful, and in some cases, a cesarean section may be needed. Labor induction methods and the risks of each method. The most common method of labor induction is the use of oxytocin, which is a hormone that encourages the uterus to contract. Oxytocin is typically administered through an IV drip. This method can be effective, but it does have some risks. These include increased risk of infection, fetal distress, and uterine rupture. Another method of labor induction is the application of prostaglandin gels or foams to the cervix. This softens and opens the cervix and encourages labor. This method has the same risks as oxytocin, but is generally considered less effective. In some cases, a balloon catheter may be inserted through the cervix to help open the cervix. This method can be effective, but it carries the same risks as oxytocin. Finally, amniotomy is a procedure in which a doctor will make a small incision in the amniotic sac. This method is generally used when labor is not progressing normally and carries the same risks as the other methods. No matter which method is used, inducing labor carries risks. Risks include infection, fetal distress, uterine rupture, and an increased risk of needing a cesarean delivery. Also, the medical procedures used to induce labor can also cause discomfort and pain. Many women find that they experience contractions that are more intense than those of a natural labor. Additionally, induction can lead to increased use of pain medications, such as an epidural. So it is important for pregnant women to discuss the potential risks of labor induction with their doctor. Knowing the risks can help to ensure that the best decisions are made regarding labor induction.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.